In this recording, I will discuss self-exploration, masturbation, and erotica as it relates to children and adolescents with intellectual disabilities. As a reminder, each of these training sessions are brief and should not be considered a comprehensive curriculum on the specific topics covered. Each family is encouraged to determine what information and activities are appropriate for their child. Self-exploration. Self-exploration is normal. Most children will explore their bodies as a way of understanding who they are and what their bodies are like. Children are encouraged to know about appropriate times and places for self-exploration. Each family will have their own preference for whether self-exploration is appropriate or not. However, know this is typical behavior for children, and the exploration may involve other children too. At times, they may compare their own bodies to the bodies of others. Masturbation. At a young age, a child touching their genitals is normal. Young children are not touching themselves to achieve an orgasm. However, as a child matures, they may choose to masturbate for the purpose of achieving an orgasm. This behavior may range by age and development for each child. It is important to discuss that masturbation should only be done in private. Masturbation is a healthy thing to do. It feels good, and if done in the absence of negative messages, it increases the likelihood that adolescents will become sexually healthier and happier adults. So, how to talk to your child about masturbation. You will want to reinforce that masturbation is natural and healthy, but should be done privately. Masturbation is quite common at this age, but it needs to be done safely. Adolescents can have feelings of shame or guilt that frequently accompany masturbation. Your child needs to know that deciding whether or not to masturbate is a personal choice that may depend on the values of their family. If you believe that masturbation is harmful, then let your child know that masturbation is not acceptable to your family. Try to do so without making your child feel guilty about their behavior. It is, after all, a normal behavior, and understand that your child will probably masturbate anyway. If your family does not object to masturbation, adolescents should understand that it is okay if they masturbate and okay if they do not. Erotica. Erotica could be considered any sexually explicit visual art. Your child may be exposed to images or videos intended to arouse sexual desire. The average age of a child the first time they see internet erotica is 11 years old. Tweens and teens are at the age of natural curiosity about sex. When presented with the opportunity and such easy access, many are choosing to view erotica and doing it more than once. If you think that this will not happen to your child, you are potentially leaving them at risk for stumbling upon sexually explicit material online, whether they are looking for it or not. Children and adolescents are not developmentally able to handle the emotional or mental impact these graphic images contain. This is especially true for a child with an intellectual disability. The ability to process what is real or fictitious becomes distorted and will be easily confusing. Despite the discomfort of discussing this topic, it is important to know the risks of watching erotica It is important to discuss the risks of watching erotica and be discussed as a family. Parents should talk to adolescents about pornography and continue the conversation. Look for teachable moments in the media and remind your child of your family values. Tell your children that erotica and pornography can be an online search result and what to do if they find it. Reassure them that they will not be in trouble if they come to you. Teach them about responsible online behavior and rules. Encourage them to turn it off and talk to a trusted adult. You may want to consider establishing family rules such as computers and laptops must be in the main living areas. Devices must be kept out of bedrooms. Phones must be turned into parents at night for charging, and you will want to block pop-ups on computers as well as put parental controls on certain devices in your home. It is your responsibility as a parent to keep your children safe in the age of technology.